Perfect. Good evening, everyone, and thank you for joining us tonight. My name is Mackenzie, and I am the Community and Provider Education Coordinator for NAMI Maryland. I will be the moderator for our webinar this evening. The COVID-19 pandemic has led to unpredictability and stress within our everyday lives. Tonight, we are hosting two special guests, Dr. Mark Komrad and Dr. Patti Friedman, who will share fundamental ways to care for yourself and loved ones with mental illness during this time. I want to start this evening by introducing our first speaker, which is Dr. Mark Komrad. Dr. Komrad was the recipient of the National Exemplary Psychiatrist Award and named Mental Health Professional of the Year in 2013 by NAMI. He is a psychiatrist on the clinical and teaching staff of the Johns Hopkins Hospital in Baltimore, clinical assistant professor of psychiatry at the University of Maryland and at Tulane in New Orleans, and has ran the ethics committee and consultation service at Sheppard Pratt for 25 years, where he teaches psychiatric residents in training. He consults to colleagues on difficult cases, has lectured throughout the country on a variety of topics in psychiatry, and has, based on the principles in his book, You Need Help, a step-by-step guide to convince a loved one to get counseling, has helped many families in the process of convincing their loved ones to get psychiatric evaluation and treatment when in need. Our second speaker is Dr. Patti Friedman. Dr. Friedman is a psychologist in Maryland and Florida. She is listed in the National Register of Health Service Providers in Psychology and presently has her own private practice in Baltimore. Dr. Friedman has served over 20 years on the Chana Advisory Board, where she has remained active in the fight to end domestic violence. She primarily treats anxiety, depression, phobias, trauma, stress, medical issues, and adjustment disorders in older adolescents and adults through the use of cognitive behavioral therapy, psychotherapy, and clinical hypnotherapy. She has found that clinical hypnotherapy is a joy to teach, and that individuals with whom she works quickly enjoy the benefits of learning to practice self-hypnosis. She has practiced for 39 years and enjoys the collaboration that takes place in her work. She believes that trust and mutual respect are the cornerstones of the alliances that she has built with those she works with. Thank you so much, Dr. Friedman and Dr. Komrad, for joining us tonight. Before we get started, I just want to let you know a little housekeeping notes that we have for the webinar tonight. To avoid any background noise, all participants will be muted for the duration of the webinar. We will be saving all questions until the end of the webinar. If you have any questions, please put them in the question box in the right-hand corner. If you have any comments or concerns during the webinar, you can also put those in the comment box and we will address any comments or questions as they come up. A recording of this webinar will be emailed to each participant tomorrow and will be available on our website at namimd.org for any individuals unable to attend this evening. Now let's get started with our first speaker, Dr. Mark Komrad. Looks good.
All right, hello, good evening, everybody. It's a privilege to be with you here this evening, along with my colleague, Dr. Friedman, Patti Friedman. Many of you I've known from various NAMI events that we've done here in Maryland and elsewhere around the country. NAMI is an organization especially dear to my heart. It's, as a matter of fact, one of my, what I call my secret weapons when I'm trying to support families and patients to try and really come to an understanding of the state of the art of what we know about psychiatry and how to help people and support people, educate people about mental illness and the challenges of having people in your family who have mental illnesses. It's not unusual for me to pull out my prescription pad and write attend a NAMI meeting on my pad that I give to patients and I give to families. In the book that NAMI graciously uses as part of its family-to-family education course, you need help, a step-by-step plan to convince a loved one to get counseling. I think I mentioned NAMI 27 times in that book. So I'm very glad to be back with my NAMI family. And I hope that I can be of value to you this evening as we really turn the perspective here from healthcare to self-care. Because this is a time in which, although self-care is always important, we especially need to step up our conscientiousness about both caring for ourselves and caring for our loved ones. Because, you know, in the words of Thomas Paine, one of our great American patriots, these are the times that try men's souls, he said back in 1776. I think this is probably one of the most challenging periods of our entire lives so far. I don't think there's really been anything that has created life that is so altered, so topsy-turvy, so not business as usual, possibly since the Second World War, which certainly was before my lifetime and maybe many of yours as well. Like a wartime effort, there's a great deal of uncertainty, there's fear, there's risk, and we don't know really at this point when it's all going to end, what the future is going to bring. So much of our daily lives have been disrupted. And in many ways, as we'll talk about, possibly even inverted, goals that we usually have to be able to function and to be out in the world are now turned on their heads as we shelter in place and withdraw into ourselves. And this presents tremendous challenges for ourselves and for our loved ones, and particularly for people who are already suffering from significant psychiatric disorders. So it is definitely a time to remember perhaps some of the old sayings that come from World War II. As in Britain, they would say, keep calm and carry on. Well, we definitely want to keep calm and practice self-care, and certainly want to try to avoid panic. But that being said, I really want to say that, in fact, it really is perfectly normal to be rather anxious, to be very apprehensive at that time. And I think that's something that really is very important for us to remember, that being distressed under these very challenging circumstances is entirely normal. And I want to really start with that point, that if you are feeling distressed and upset, anxious, uncertain, all of that absolutely is normal, and those feelings are very widespread. Here is a poll that was done by the Kaiser Family Health Foundation that shows these different cohorts of people, and people saying that indeed this time has had a very significant impact on their mental health. You can see it broken down into male and female, people saying it's either had a major impact, minor impact, different racial divides. But in short, between 1/5 and 1/4 of people say that what they're going through now, both in terms of their concerns about their health and health care and economics, between 1/5 and 1/4 say it has had a major impact on their mental health. Now, this poll was actually done several weeks ago. It's interesting how overall human beings are pretty resilient in the way in which we're learning with each passing week to adapt to these changing circumstances. I think that probably these numbers have gotten a little bit better as the weeks have gone on, but it's still, the point is that to feel distress, to feel an impact on your mental health now is perfectly normal. The American Psychiatric Association did this poll about 3 weeks ago, and they showed that in this random sample of Americans, about half of people said they were they were quite anxious that they would get the virus themselves. Almost 2/3 were worried that a family member or loved one would catch the virus. Over half were concerned that it's going to have a very significant impact on their crisis due to the shutdown of the economy. 2/3 feared that, in fact, it might have a long-lasting impact on the economy. Over 1/3 said that the coronavirus is having a serious impact on their mental health. That's actually even higher than the Kaiser family study that I just showed you. And nearly 2/3 feel that it's having a serious impact on their day-to-day lives. But there were about 40% who said that they thought people were overreacting and being overly cautious. At the same time, another 40% said that they disagreed with that statement. So not everybody was seriously affected by this, but you can see these are pretty large numbers of how Americans responded to this poll about how concerned they were about this virus. So we want to look at a kind of a range of reactions, beginning with those that I think are very common, normal, indeed healthy, which are distress reactions. I think that to not have distress in a way is a form of denial, although sometimes we do need denial as a way of coping. But distress reactions that I think so many of us very widespread are experiencing include changes in sleep, feelings of being unsafe with regard to our health, irritability, being distracted, avoiding things that normally, we would like to be getting done, and of course, even grief, and not just grief about losing somebody, having lost somebody, but in fact, very few Americans, compared to the vast population, have lost somebody due to this illness so far, but grief about the way in which normal life has been disrupted, in which our freedoms have become compromised voluntarily compromised, and compromised in the interest of the common good. But there's a lot of grief about what we've lost, including things that have been given up, weddings that have had to be canceled, life cycle events that have had to be canceled, theater tickets that had to be canceled, cruises, and so forth. So those are distress reactions. Now, if we're not careful, the next step is that distress can lead to behaviors that are risky, that are probably not good for us, that are not helpful for coping, or at least they may work in the short run, but may be harmful in the long run, like turning to alcohol and other substances, developing significant imbalances in the way in which we manage the boundaries between our work and the rest of our lives. We're still lucky enough to have a job, or turning to take out our frustrations on others, including our loved ones. And then at the farther end of the spectrum is the development of psychiatric disorders, which are really, we're beginning to see emerge for the first time for some people in this crisis time, or for others who have underlying psychiatric conditions, and exacerbation of those problems. Depression, post-traumatic stress disorder, anxiety, grief reactions. And we want to be careful about the emergence of new onset disorders as well as exacerbation of underlying disorders. Well, let's just focus for a minute on this, the most common level of reaction here, which I'm calling distress reactions. And there are many sources to keep us distressed. One is the fact that we're dealing with this invisible enemy, this threat of this virus, which seems very powerful, seems far more risky and far more dangerous than most of what we're used to confronting in terms of our ordinary health risks, our ordinary infectious disease. There's still a great deal of mystery to it. One is hearing how we're trying to learn about it, but there's still much that is not known about it. We do not know exactly what the risks are. There is still not yet enough data to be clear exactly who are more at risk than others. We have a few generalities, and yet every time we think we have captured some generality, like being older, then we hear about awful cases of people who are young. So there's a lot of ill definition about the risks. There's distressing inconsistency about the policy recommendations from different regions of the countries, from different states, changing recommendations at the national level. And I think that that is very disconcerting. There's misinformation out there, a great deal of misinformation, as a matter of fact, inflaming our fears. Some people are even taking advantage of this opportunity to sow a little bit more chaos and mayhem. There's always that element of society, like, for example, hackers. There are shortages that we're all confronting. There's the uncertainty of who has the illness, lack of testing, non-specific symptoms, the fact that some people could have the virus and be relatively asymptomatic, the false negative rates that are emerging, that even if you have a negative test, it's not an absolute guarantee that you do not have the virus. Obviously, we're all confronting major topsy-turvy disruptions in home and work life, financial insecurity, and social isolation is something that's, I think, very, very critical. And there are some people that already suffer at the margins of society that are now even more isolated. And that obviously is distressing and can actually really exacerbate pre-existing psychiatric problems. And of course, if you have to go into quarantine because you're ill and be even further separated from the family members that you may already be connected to, that's going to be distressing as well. You know, uncertainty, I think, is definitely a part of the current distress. You know, there are a number of studies that have been done showing the more information you know, the easier it is to cope with things. I think airplane pilots learned that some time ago when they started to change the policy that if you're standing on the runway waiting to take off and there's a delay, the pilots have learned to update you about the current status of where you are in the line to wait. That number of studies actually showed that that led to significant calm among the passengers. There's loneliness and frustration and even scapegoating of the ill, resentment of people who are ill. So many of these things are happening, but at the same time, our distress can also lead us in positive directions. And I think that's very important to note, that, you know, necessity is the mother of invention, and distress is also the inspiration sometimes to not just have solutions, but to be able to connect with other people, bond and help other people. I want to say a few words about a potential cause of distress, which is the media. The media is a double-edged sword. It both provides our information that we need in a way that hopefully is timely and accurate, but at the same time, media, especially in these days of so many different, many and varied sources of media, can contribute to misinformation and fear and increase our distress. I'm talking to my patients a lot these days about what I'm calling media hygiene, which I think is something that we all need to be observing along with our hand washing hygiene. That it's important that we be clear of, first of all, tapping into reliable sources. Secondly, being able to put ourselves on an appropriate media diet so that we're not overwhelmed with being bombarded by media. And remember that media has a long tradition of trying to bring out some of the more purulent and more exciting as well as scary issues. So there's so much out there in the media that may actually not be very relevant to exactly what we need to be doing with coping at this with this crisis at this time. And then there's understanding the media, being sure that you are actually getting sources that you're capable of understanding. Some of my patients have been trying to read complex medical literature at this time to try to understand issues of ventilation and oxygenation and antibiosis and things like that, that can sometimes be very, very confusing if this isn't your usual wheelhouse in which you traffic. So sources, time, and understanding. And to that end, I do want to say that probably the single most reliable source of information is the CDC site, the Centers for Disease Control, cdc.gov. I highly recommend this as a very important centerpiece of your media hygiene. This is the right soap, so to speak, for your media hygiene. So I would find this site, bookmark this site as your trustable go-to source of the latest information that we know about this virus and what's happening with efforts to both ameliorate it with treatments and to develop prevention strategies, including vaccines. All right, so reliable media sources and putting yourself on a media consumption are important strategies for coping. I even recommend occasional sabbaticals from the news. I myself try to take a sabbatical every weekend, at least one day of the weekend, where I'm not checking in with the news. Things are not evolving that fast that you can't afford to miss a day. That's not so. This time of social distancing, it's very important to compensate for that social distancing by creating social connections. You know, people are developing all sorts of creative ways of using virtual visits, virtual dinners with friends, virtual parties with friends. We just had Passover, where many people around the nation had a virtual Seder for Passover. I know our family did. And we actually were able to connect with people further and wider than we ever have before, thanks to Zoom. Recreational time, it can be actually very difficult if you're working at home. It's always difficult to strike a balance between work and life. And that somewhat is helped by having a different geographic location to go to when you're working. But I think that when you're working from home, you need to be particularly scrupulous about trying to establish work stop times, work begin times, and to take breaks, to have recreational time, exercise, connecting with nature, as well as card games with relatives online and virtual play dates for your children. I do think that it is important to process our fears, to talk about our fears, to not get stuck inside of your own head, sharing some of the things that you're thinking about, even some of the things that you are particularly afraid of with others, can help quell your fear and not get lost in the echo chamber of your own mind. This is a time to especially be careful about self-medication with substances. Remarkably, the liquor stores remain open. You can argue both the pros and cons of that decision. But this is a time that many people are turning to self-medication. And this is an especially vulnerable time for those with pre-existing substance abuse disorders. I think that being of help to others, numerous studies that research happiness and well-being keep coming out with the same finding, that being of value to others, being useful to others, seems to be a formula for well-being, centering, and happiness that is revealed in study after study of what are the factors that are most associated with well-being. I think that it's important for your children, especially, to present being calm and being in control for your children. It's with fellow adults that you want to present your worst distresses. It's especially important for children at this time to show them physical affection. So many people are more at home now who often work outside the home. If you live with others, it's important to rotate the in-home responsibilities. You know, the person who usually doesn't cook should be cooking sometimes, and the person who doesn't do other household responsibilities because they're at work maybe should take those up. Gratitude is another tremendous centering project to begin to focus on those things that you're grateful for, that you have shelter, that you have family, that you have perhaps, I hope, enough resources to make it through this. And of course, techniques, specific techniques of calming, mindfulness, and relaxation that we're going to learn a little bit about from Dr. Friedman when I'm finished. Loneliness, though, I think is something that is very, very problematic at this time for some people. Here's an excellent article you can find on the internet about the way in which loneliness may be taking its toll on some people. And I think this is something we want to especially think about as we now move into talking about your family members who are already suffering from psychiatric problems. Heretofore, we've been talking about getting your own oxygen mask on if you're a family member. Like they tell you on airplanes, to get your own oxygen mask on first before you turn to help the person next to you get theirs on. So self-care precedes always caring for somebody who is in more trouble than you are. So there are a lot of possible side effects, of this time on people with mental illness, especially those with serious mental illness. And some of these things are things I'm beginning to see with my own patients, and I've heard about from colleagues' patients. People with major mental illness may be suffering from more paranoia as they're using computers more now, perhaps to connect with their doctors. A lot of people have paranoid ideations around the use of computers, people hacking their computers, worried their computers are being tampered with. In inpatient environments, seeing staff people wearing masks can exacerbate paranoia. The idea that hospitals now are places where people with COVID go can only increase the already sensitivity to whether or not hospital is a safe place. We're seeing people with delusions who are feeling that government conspiracies are afoot in this COVID epidemic. Frankly, we're even seeing those ideas elaborate in people who don't necessarily have mental illness, but certainly those who are already prone to these kinds of delusions are particularly susceptible to this. People with affective delusions, depressive delusions. I've had some patients who've started to think that maybe this whole epidemic is a punishment for them or a punishment of the world for something that they did, these kind of negativistic, nihilistic, grandiose delusions that some people have. Hallucinations can be a problem. We've seen some people talk about hearing the sound of the virus in their body. People with auditory hallucinations may have difficulty communicating with their treaters by phone. Many different kinds of major mental illness already come with cognitive impairments, make it difficult to understand information that's out there. And also, as some people turn to self-medication with substance abuse or have comorbid substance abuse disorders, that may further interfere with their cognitive capacity to digest and metabolize all the news. Many people with certain kinds of chronic mental illnesses like schizophrenia already have difficulty with caring for their own hygiene, and they have a lot of self-neglect. They may already be disorganized. It may be especially difficult for them to maintain social distancing, wash their hands, and so forth. And people who have other kinds of psychiatric disorders, you can imagine the ways in which this epidemic may be exacerbating those. Increased symptoms of obsessive compulsive disorder, particularly those who are afraid of germs. Many have had a couple of patients, who have told me, I told you so. Now the whole world understands what I understand. People with social phobia are experiencing, more reticence to engage with other people, as perhaps all of us are, at a time when one wonders if another person could be carrying, a deadly disease. Exacerbations of depression and substance abuse, I think that's apparent. In those who are in inpatient settings, we're finding that many hospitals now have fewer inpatient psychiatric beds available as they convert their rooms to single rooms in the time of COVID. The activities that are part of inpatient care may be decreased. Patients are sitting farther apart. There may be less freedoms to move around the unit. Many units are now closed to visitors. Many psychiatric hospitals want to have some information in advance as to whether you might actually have COVID and if the virus, and if you do, they are screening out those admissions. Some inpatient units are even asking people to have COVID testing before they're admitted. It's much more difficult to find aftercare if you're in a hospital. As a result, there are longer lengths of stay. And there have been epidemics in some inpatient units. For example, one psychiatric hospital in eastern Louisiana had a very significant outbreak among patients and staff. On the outpatient front, many day hospitals are closed, which are often are used as step downs for inpatient care. It's increasingly difficult. There are a lot of psychiatrists and other professionals that are reluctant to have their initial evaluation of a new patient by telehealth. That's coming online a little bit more. It's difficult to convince people to get lab testing. Remember, some medications you need lab testing on every week or every other week or every month, such as people for clozapine. Because a lot of outpatient clinics are less available or closed, it's difficult to get people long-acting injections of antipsychotics because, and many patients are being converted back into oral forms of medication, which is problematic in its own right because they were often put on the injectable forms because they weren't compliant with the oral medications. Methadone clinics are less acceptable. And of course, many people with major mental illness have other medical problems, and it's difficult to get routine medical care for those things. Crisis teams are on skeleton crews. A lot of people don't want to go to the emergency room because of the risk of possibly encountering patients with the virus there. Many residential programs are closed for new patients, so it's very difficult to get people to these kinds of aftercares. So if you have a mentally ill family member who has a serious mental illness, the important point of the day is more support from you is going to be needed at this time. More in-home support is going to be needed. It's never one's first choice. It's one of the last things we try to do to hospitalize people or to take them to the emergency room, of course, even in the best of times. But at this time, it's something that even more we want to try to avoid if at all possible. So that means they're going to need more from you, their family members. You want to make sure that they have proper information and are not misinformed or haven't gone down the rabbit hole of some conspiracy website, hopefully. This is a time that you may want to consider taking a mentally ill family member who may be living alone. If they don't appear to be ill from the virus itself, you may want to consider taking them back into your home if it's safe and if it's possible. I've actually been counseling several of my families that this is a time that I think it is in the best interest of their family member to have them come home during, if they live apart, especially if they live all alone, as opposed to in a supported residential program. This is the time to increase the support and to make sure that they're having access in alternative ways, by phone, by telehealth. This is a time where, especially if you're living with your family member, you may want to ask to be included in a telehealth session or in a phone call with the treating professional. To talk about how things are going, to get some support yourself and some input as to how to optimize the care. I've been seeing some of my patients' families who I normally don't see or rarely see, who are either coming into the room or I've asked my patients if they could bring their family members into a session. There are some in-person visits, though, that are still happening. You definitely want to encourage them to stay on meds. You want to ask the doctors to try to give the maximal number of pills for a prescription that is safe and covered. Many insurance companies now are extending the amount of coverage that they will give, that normally giving 30-day supplies. They're now extending it to be able to give 90-day supplies so people can make fewer trips to the pharmacy. I'm trying to write on all prescriptions that I'm writing now, please dispense 90 days if the insurance covers. And I think that's an important thing to ask if the doctor considers it safe. Obviously, there are some times that might be contraindicated. Do not wait for the last minute to the last pill to ask for refills. Interestingly, with regard to clozapine, many of your family members may be on this medication that requires regular lab testing. There is now a new policy that's issued that in select cases on a individual basis, physicians may ask, order that a lab test can be skipped for clozapine. If a patient has been stable, doesn't have any other risk factors, in order to keep patients out of labs, that is an option that is available that you should be able to ask your physicians about. Very important to remember that sleep is medicine. So to try to create a felicitous sleeping environment and encourage your loved ones to look after their sleep is particularly important. Some of these recommendations are true for all times, but are especially important to remember now, such as make sure there are no firearms accessible in the home, or if so, that they are strongly secured. Minimize, if you're living with somebody with a mental illness, this is a time actually probably to be modeling for them, minimizing the use of alcohol, marijuana, and other things in the home. And a good time to encourage peer and family support groups that NAMI runs that are available on the NAMI website. They're now doing call-in groups and also have information there about how to mobilize mental health crisis services that are still running, albeit on a more limited basis. You know, in psychological first aid, here's an app that you can download for free about psychological first aid. So the whole thing, I'm not going to get into it right now, but the fundamental goals of psychological first aid are our goals here with our loved ones. First of all, their safety, the ability to keep them calm, allow them to feel a sense of efficacy, agency, and instrumentality in their daily life, give them feelings of connectedness, and instill in them hope and optimism. I'm actually, I was going to share this video with you all, but I think in the interest of time, I'm actually going to skip the plan to show this. If you just go to YouTube and just search for Face COVID, this is a wonderful little animated 5 minutes about how some of these principles that we've been talking about today and how to cope. But for now, I'm just going to skip over this and simply wrap up by saying also the state of Maryland, you can go to their YouTube channel, just search for State of Maryland COVID-19, and they have made this really neat set of 30-second public service announcements, infomercials that go over a lot of good basic things with a very brief 30-second message about mental health, stress, and anxiety in the time of COVID. And of course, this is the NAMI Maryland website specifically for coronavirus resources. So it's the usual namimaryland.org/coronavirus_resources. And they'll also tell you about future webinars that are coming up, as well as be able to direct you to their now emerging excellent conversion into online and telephonic support groups that they are running. So James Baldwin famously said, "Not everything that is faced can be changed, but nothing can be changed until it's faced." So we are facing now something perhaps that we haven't faced before in quite the same way. And by facing it, I hope that we'll find solutions not just to this epidemic, but to begin to see the fissures and cracks, weaknesses, and vulnerabilities in our mental health care system, which are being very much magnified in this time of crisis. So it's a time that in many ways it is a battle. We all have our own personal battles to face, the personal battles in our daily lives, as well as our national battle to face this virus. But in facing that personal battle, in entering a time that is perhaps one of the most extraordinary in our lives, it is a time that can invite us to be more than we are, to try to identify, solve, and dream solutions, and perhaps have a both personal will and political will to find those solutions, whether those solutions are about the symptoms that you face or the symptoms that a loved one faces, or those solutions are more systemic on the basis of how we can build a better healthcare system while we're all practicing better self-care. So I now turn you over to the second part of our program, which is my colleague, Patti Friedman, who is now going to give us an experiential segment in which she can help all of us to maybe find our center a little bit more and give us an example of how you can dial it down and perhaps find a calmer and peaceful place. Patti?
Good evening.
Over to you.
Good evening, Mark. Thank you so much. We're all so tired and we're all so worried. And I would like to take some time with you now to just relax. And so if you can take a few moments now to find a quiet, comfortable place where you can focus solely on being present. Take a few minutes now, whether you'd like to lie down or if you have a comfortable chair that will support your head. Whatever you choose is just fine. Become as comfortable and as free from distraction as is possible. And take your time. This is your time. Your eyes have closed. Take in a deep breath. And now let it out. And as you do, begin to focus your attention on the sound of my voice. Beginning to focus all of your attention that you're able to on the sound of my voice. It's time to rest now with a calm and quiet mind. Take in another deep breath now and hold it. And now exhale. And as you exhale, feel the sensations of relaxation now beginning in the various muscles throughout your body. And continue to breathe slowly, deeply, and evenly. Feeling your relaxation deepening with each breath that you take. Beginning to let yourself rest. Focus all of your attention right now on the feelings in your forehead. Just imagine that you can visualize those very tiny muscles in your forehead loosening up, stretching out, and then relaxing. Just stretching out, moving apart, and relaxing. All the tension leaving these tiny, tiny muscles. And now feeling the same relaxation moving down across the bridge of your nose and into your cheeks. Just let your cheeks hang limp with relaxation. Relaxation moving into the muscles around your mouth and to the muscles of your jaw. Visualize in your mind's eye a candle that has been lit. And now watch as the wax drips down both sides of that candle. Now allow the muscles of your cheeks and your jaws to just droop and melt like that very hot wax on the candle. And let your cheeks hang limp with relaxation. Allow your jaw to hang loose and slack with relaxation. And even the tiny muscles in your scalp tingling for just a moment at first, and then loosening up and relaxing. All the muscles in your face and your head now relaxed. And relaxing more and more with each breath that you take. And continue to breathe slowly, deeply, and evenly. Take your time. This is your time. And now feel this relaxation flowing down into the muscles of your neck and your shoulders. Just be aware of any tension or tightness that you may have in your neck and shoulders for a moment. Now allow your shoulders to gently drop down and back. And now let all of this tension and tightness leave you at once. Let it go. The tension just floats away. And now your neck and shoulders are becoming soft, supple, and more relaxed. And now feel that gentle wave of relaxation flowing down into the muscles of your arms and into your hands. Your arms may feel so heavy that you don't want to lift them. So just let them stay this way, relaxed. And now the muscles of your chest, your stomach, and your abdomen are all relaxing as well. And continue to breathe slowly, deeply, and evenly. Even the muscles in your back, down both sides of your back and in your lower back, they're all relaxing as well. All the muscles in your upper body now more relaxed. Just let your back melt down into the chair or the bed and keep letting go. And now relaxation moving down into the muscles of your lower body as well. Feel that gentle flow of relaxation as it enters the muscles of your hips, your pelvis, your thighs, And now flowing slowly down both of your legs and into your feet. All relaxing now, just that easily. Notice how heavy your legs begin to feel as they go more relaxed. All the muscles throughout your body more relaxed. Beginning to feel more and more at ease. More and more calm. Feeling safe, secure, and more serene now. And really beginning to rest. Really letting yourself rest. And continue to breathe slowly, deeply, and evenly. Perhaps you'd like to drift a bit deeper now to gain even greater benefits. And so now, begin to form an image in your mind's eye, your imagination, an image of yourself stepping into a beautiful elevator. You walk in and turn around, the doors close. You'll see that the number 20 is lit on the light above the door. I'm going to count from 20 to 1. And as I do, you'll see the lights change and you'll feel a downward motion. 20, 19, 18, moving down now, 17, 16, 15, 14, 13, more and more relaxed, 12, 11, 10, 9, 8, so much more at ease, 7, 6, 5, 4, 3, 2, and 1. And now the doors open and you step out. And this image fades from your mind completely. And as it fades, you'll enter a deeper, calmer, and more relaxed state than before. Much deeper, much calmer, much more deeply relaxed than before. And feeling free from tension, stress, or strain of any kind. Feeling free from worries of any sort. Feeling free of any discomfort. Every part of your body feeling at ease, still, and rested. So much more at ease now. Safe, secure, and serene. And so you begin to experience within yourself a special part of yourself that you may have not always thought about or known about in the past. A part of you that's very calm, very quiet, and very, very strong. This part of you is always there. And the strength and the resources of this part are always available for you. Always there to support you. And so you feel extremely confident just knowing this part of you will always be there. And that even if you forget about this part of you at times, it continues to work inside you, with all of its reserves of energy, all of its abilities, all of its resources to support you with whatever you may need in your life right now. And so you begin to feel more and more confident, more and more self-assured every day, just strengthening yourself, connecting yourself to this part of you that has all of your strengths and abilities. And so you just enjoy this part of yourself, so calm, so quiet, and so strong. Feeling safe, secure, and more serene, and able to cope with anything that you need to cope with right now in your life. Just enjoying the sense of this calm, quiet strength that resides within yourself. Safe, secure, and serene. And so knowing that you can return to this state of mind whenever you need to, whenever you wish, you get ready to wake up completely. Also knowing that when you do, you'll be completely free of tension, stress. You'll be free of discomfort of any kind, physical or emotional, and feeling ready to cope successfully with whatever you need to cope with in your life right now. And so I will count now from 10 to 1. And at the count of 1, you may gently begin to open your eyes, waking up and feeling completely fine. As good as you can feel, and comfortable in mind and body and emotions. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you.
That was so wonderful. It's the best I've felt all day. I don't know about the rest of you.
Thank you so much, Dr. Friedman, for sharing that relaxing experience for everyone. I hope that all the participants felt even more relaxed with that. We will now open up.
My pleasure.
We will now open up the floor to ask any questions or make any comments about what you had experienced. I know that we're cutting it a little short on the time, but we can certainly make time for a few questions that have come through. Our first question is regarding virtual companionship. Someone would like to know how virtual companionship could be beneficial at this point in time.
Well, I certainly think that virtual companionship is maybe something that we're all experiencing now. It really is kind of the new normal. I certainly am connecting with my friends in a way that I never have before, virtually, online. In fact, I've rounded up a group of old college friends that I usually like to hang out with at reunion time every 5 years, and now we're getting together every single Sunday. So I think that's one of the things that maybe I can ask the NAMI folks is I know that NAMI has a peer-to-peer support program, and they also have one-on-one supports that are available through peer supports. And I wonder if you all are making that kind of one-on-one support now available virtually. Mackenzie?
Yes, so we are currently working diligently to get virtual support groups up statewide. We do have a few local affiliates that are currently working on that process, and we will certainly send everyone on our listserv updates with that information. So if you did register for this webinar, you will receive that information, and we will also be updating our website regularly, which is namimd.org.
Great.
Patti, do you have anything to add?
I would encourage all of you to seek out any form of solace right now. Something as simple as an app online, such as Calm, where you can go on to the app. It's free, and you're able to try all different kinds of meditations, from very simple to advanced. Also to think about what might be most relaxing to you, whether it's the sound of the ocean or the sound of a bubbling brook or stream, to utilize that and bring that into your life right now. I think we need to be really mindful of what brings us a sense of calm, a sense of peace and serenity, and to really commit to making that important in our lives right now.
Patti, it's interesting you say that, because I don't know whether you had it recorded or it was in your home, but there were some lovely bird sounds during your script, and that for me is actually a very, very relaxing sound.
The birds, I had the window open and the birds are just outside right now, so we got lucky with that. Yeah.
Perfect.
Okay, our next question is, to what extent is anger normal? By anger, I mean anger at people you see on the street who don't seem to be taking protective measures advocated by health authorities.
Yeah. Well, I would say that, of course, anger is a normal emotion, right? It's one of the flavors of jelly beans that we all get with our emotions. And frankly, you know, like with many emotions, it evolved with probably with good evolutionary purpose, that it was a survival technique. So, you know, the issue isn't about whether anger is normal or abnormal. I think anger is normal, and the issue is all about how we express that anger, particularly in a civilized society. As a matter of fact, it was Freud who famously said that the inventor of civilization was the first guy to hurl words instead of stones when he was angry. But you know, anger is kind of a title that has many nuances, and there are other nuances that are also under that same umbrella, such as frustration, for example. And I think that certainly seeing others that may be not heeding the common good through their behaviors can be very, very frustrating. And also, I think that at this time, it's easy to sort of displace one feeling into another. Sometimes anger is the place that we shift one feeling, a feeling from somewhere else, such as fear, anxiety, and we can turn to find who to blame and who to be frustrated with and engaged with when we're feeling helpless. And sometimes fear can be encoded as anger. So another thing to also be thinking about is the degree to which, when you're feeling angry, is it coming from another emotion that perhaps at the moment, the way you're handling that is by transforming your, for example, your fear into anger. So the question is, what do you do with people that, you know, aren't observing proper social distancing? And, you know, there are various ways of expressing that, including not expressing it at all. some of which may be helpful and constructive, and some of which may be destructive, and we don't want to go there. Patti, what would you say?
I agree with you, Mark. I think also that when we're seeing anger now, it's also tied into fear. It's tied into anticipatory anxiety because we just don't know what to expect from day to day. And also, I think people are really hurting from the sense of isolation. I have seen a couple friends and we walked far apart, but really missing the ability to just give a dear friend a hug. And I think that sometimes frustration or fear or anxiety can present itself as anger as well when our needs are not being met.
Definitely. So you may have to decode that anger.
I think we're all just frustrated, and there's no game plan right now, so it's very difficult for people.
Thank you, Dr. Komrad and Dr. Friedman. I don't want to go too over time, but I did just want to share one comment from one of our participants. They shared that the guided meditation exercise really felt wonderful. I try to do it every night before bed because I feel tension in my shoulders from time to time and have been experiencing a lot of anxiety. Meditation really helps. Thank you so much.
That's great.
So thank you everyone for joining us. We hope that this webinar has been helpful for you this evening. Please remember that the webinar has been recorded and will be emailed to each participant tomorrow. This webinar will also be available on our website at www.namimd.org for any individuals who were unable to attend this evening. We wish you all a safe and healthy night, and please do not hesitate to reach out to us should you need any additional resources or support. Good night, everyone.
Good night.
Thank you.